Hello, I'm Lisa Tan and welcome to this week's edition of Oxwide. Coming up in today's programme, we'll be speaking to some of our shadow executive team about their experiences over the past year and why you should think about giving it a go. We'll also go over to Queen Mary's, where our Chief Exec Ify will be giving you some straight facts about getting the flu vaccine. Even if you think it's not for you, please listen to what he has to say. There's a lot of food for thought in there. First up today, we're going to look at Oxcare, an exciting new project being developed by our hard-working staff in clinical transformation. It's going to go live this coming Monday to a select number of our teams. But what is Oxcare, I hear you ask? Here's Maeve Malley to tell you more.
Hiya, I'm Maeve Malley. I'm a consultant psychotherapist in adult mental health in Oxleas, and I'm also a closet tech nerd. I'm really enthusiastic about the potential of tech for clinicians, but mainly for clients. So when I heard about Oxcare, I was just so overexcited. Mainly because I think one of the things that can feel so excluding to people using our services, our mental health services, our community health services, is a real lack of control. That they don't necessarily feel involved. They feel that things are being done to them. And that doesn't help anybody. The point of Oxcare is having a portal, one of my few tech words, okay? A portal which is theirs, where they can actually have access to their notes, their records, care plans, letters written about them. They can fill in questionnaires, but also there is a community context, and that means that they can share experience within it, or indeed not share experience within it, that they can invite people to be part of the community. They can let some of the clinicians, some of the people working with them have access or not. They can be talking to some of the people that they meet in services or not. One of the things that's really important to clients and to all of us all the time is the people who are close to us, what I call significant others. And that may be family, it may be friends, it may be people you work with, or people who are trying to help you in some ways. And I think that one of the things that maybe the pandemic has taught us all is when we don't have people around us in some ways, or if we can't work out a way to have contact with people, how adversely that affects us. The point about the community feature in Oxcare is a way that the people we work with can manage contact with other people, but they're in charge of it. You know, it isn't just contact when you rock up to appointments. It's actually having access to talking, to listening, to feeling heard at times of your choosing. And you're in control of it. You manage it. So I think in terms of, one of the reasons that I wanted to talk about Oxcare is for all of us to realise what an incredible resource this is for us and for our clients, but also really to think about the levels at which it can be helpful. It's not just about feeling in control of what's said about you, it's feeling in control of what you say and the people to whom you say it, and having that on hand when you want and when you need it.
So Ify, can you tell us what Oxcare is?
So Oxcare is an online health record. It's really the same as, say, the NHS app that we all carry on our phones. That's got our health information that we can access whenever we want to, in our own leisure, when we're comfortable, when we think it's the right time, we've got space and time to look at it. It's confidential, so information is entirely confidential, but it's also up to you as to whether you want to share it with your family.
So what difference will Oxcare make to patients and staff?
Oh, huge, huge. So for patients, of course, what that means is you can access your record, so you know what's written up about you. Your care plan will be in there. Staff can send information to you that will help you to manage your condition, get to know it better. And they can also send you questionnaires, that you can complete to help them see how you're doing. So it really means that for you as a patient, you don't have to wait until you have that one appointment, perhaps every few weeks, every few months. That in between those appointments, you're still getting some form of support. And then, of course, for staff, as I've said, it gives them the opportunity to ensure that each user of service has all the information they need to help them to continue on their journey to getting better. And for staff who particularly want to know how people are doing, just being able to send those questionnaires and looking at the questionnaires ahead of an appointment, for example, huge benefit. It perhaps will cut down the amount of time you spend trying to recap because you've already got all of that information. So I think it really will revolutionize the way we do things. Quite innovative, I would say.
So what are the next steps for Oxcare?
So the next steps, of course, are that some of our teams, a select number of teams, have agreed to begin to use this. So they'll start talking to users of services, patients, to help them understand what it does, what it's about, and also get their consent. And once we encourage enough number of teams and people to try it out and we improve it some more, then we'll roll it out to more teams. Until in the next period, perhaps a week or two, I think this will then become in common use in some of our teams.
So that's Oxcare. We're really excited about this and how it's going to change the way our service users, families and carers interact with us. There'll be lots more about this over the coming weeks on our news and social media channels, so please do make sure you keep an eye out for all the latest news and developments taking place. Now on to our next piece. And at the start of this year, we launched a brand new initiative aimed at bringing fresh thinking to our senior decision making and helping colleagues from across Oxleas develop new skills. They are our shadow executives who work closely with our executive team, and it's safe to say that it's been a huge success so far. Starting today, we're looking for more of you to join this brilliant team. Take a look at this short film we made in the week, and hopefully it'll inspire you to find out more.
So the Shadow Executive is a group of 12 Oxleas members of staff who come together to look at our executive papers and provide input to us and really bring their insight and their vigour to our decision making. We wanted to bring fresh thinking. We are very aware that senior groups of people work together really often and they can sometimes slip into groupthink. And we wanted to make sure that we benefited from the really rich insight that people who are working on the front line, who are working in a whole range of different roles right across the organisation, can bring into our decision making.
The purpose for me is to develop senior management skills, to empower people to be able to make decisions about how the trust is run.
It gives, I guess, staff at all levels an opportunity to really have exposure to and get under the skin of some of the things that the board and the exec will see on a day-to-day basis, which normally in your busy day-to-day job you wouldn't necessarily see. I
think development-wise I've learnt a lot about how those decisions are made, the documents that executives need to go through, the kind of decisions they need to make about finances, about clinical safety, patient safety.
It got me in touch with actually what it means, from a clinical perspective. And for some of my colleagues clinically, it got them in touch with some of the issues that we are facing from a corporate perspective. And so for me, it was really important and eye-opening.
And we often find that discussions with them around well-being or around equalities bring a really different sort of perspective, and we always reflect within the executive team just how valuable their input has been.
I have seen minutes where our views and the things we've discussed have actually been discussed and taken into consideration when those decisions are made. So for me that's really been a big icebreaker for a lot of us who didn't know how those those decisions get made, and the fact that our voices are heard at that level. And also, I think it's really good to get the perspective of people on the ground who are managing patients on those decisions made at that level.
It's a really nice way to have an opportunity to be heard and to influence. And my experience of being on the shadow exec, from all the meetings, you have the CEO and you have executive members on those meetings. They actually want to hear. So it gives you a platform to share some of the stuff that maybe clinically or on the ground you might not necessarily have shared, and some of your ideas directly to a real senior management team. So for me it matters because it's engaging staff at all levels, and also it's giving people voice.
Don't be shy to ask questions and ask for help, because we did, and we got specialist directors come in and talk to us about those documents and explain what they mean to us. I think for me, allow 3 to 5 hours a month just for reading the documents, but always have your comments, no matter how small or trivial you think it is.
This year, our very first year of the Shadow Executive is coming to an end, and it's been fantastic. We've really enjoyed working with these people, and they've really brought some great insight to what we do. And we're now moving on to the second year, so we're looking for people at all levels, at all different roles across the organisation, to come together and to apply if they want to have a really good development opportunity in terms of what they learn about working in Oxleas and the complexities of some of the things that we deal with as a trust as a whole. So it's a really good development opportunity, but it's also an opportunity to shape how we do things.
I think it's really a good opportunity to meet other people in the trust that you wouldn't normally meet, because it's quite a wide range of people from different parts of the trust that are selected to be on the shadow exec. So it's a good opportunity to meet other people.
I say to anyone thinking about applying to the shadow executive, I'd say go for it. Even if you think, I might not be the best candidate, I think it is a great opportunity, and I think it's not about being the best candidate, it's about understanding issues and being willing to share thoughts and opinions. You get to have, we built a really good community within our shadow exec, and it became quite a safe space, and we had a lot of laughing and joking amongst reading, of course.
So if people are interested, all the details about how you apply are on the Ox, and if people want to talk about what it involves, they can get in touch with Sally Bryden or myself, and we're very happy to talk through what it involves in practice. But there are some great case studies on the Ox that give people a flavour of what it's been like for the people who are currently on the shadow executive, and I think they've all really enjoyed that experience.
I'd say go for it. It's a really great opportunity, and also if you really want to understand what it means to run an organisation and what it means to actually understand key issues, it's a great way to do it, and it's a safe environment to do it where you can learn and not be afraid to make mistakes.
Thank you to Stephen and the two Rachels there. And if you're interested in applying to become one of the Shadow Executive, take a look at the Ox News section where we have lots more details on this. And finally, as you've probably already seen, our flu champions have been working tirelessly across Oxleas, making sure as many of you as possible are getting protected in what could be a very difficult winter season for everyone in the NHS. But despite their efforts, we as a trust still seem to be somewhat reluctant to be vaccinated against the influenza virus. And once again, we're one of the poorest performing trusts in London when it comes to flu vaccination uptake, leaving many of us here feeling frustrated and despondent that we're not protecting each other and the public like we should be. That's a view shared by our Chief Executive, Ify Okocha, who spoke to me earlier in the week and gave his reasons why we should all get the flu jab. So, Ify, it's no secret that we've struggled with our flu vaccination figures amongst staff every year.
Yes.
So what would you say to people, to members of staff who say, I've never had the flu, I've never had the jab, why bother now?
Yes, no, you're absolutely right. We have struggled with flu vaccination uptake rates. But what I'll say to people is just look at the last 18 months, how we've struggled with COVID. And although the prevalence rate is rising, in other words, the proportion of people who are testing positive is rising, infection rates and hospitalizations are not as high as they were last year. And that's largely on account of the successful vaccination program that we have in this country. Now, similarly, I think that unless people begin to take seriously the flu jab, the rates and the admission rates and the death rates will continue to rise. So what I say to people is, if you've not done it before, then this is the time to make sure you get it. And whilst you're at it, also get your booster jab if you've had your COVID vaccinations already. So we've got to do something different this time. And here is a good point to start. And the other thing to say, of course, is that unless we have high enough rates, we're not likely to have what I would describe as the immunity that we're looking for, the so-called herd immunity. So we must contribute as citizens in this country to get our flu vaccination so that we can protect people and protect our families.
And what would you say to people who, sort of on principle almost, say, the NHS can't make me have a vaccination if I don't want it?
So every year we know that in England and Wales, about 25,000 people or more die from flu. We really need to contribute as NHS staff to a reduction in those rates. And one of the ways of doing that is to make sure that we are vaccinated so that we don't pass on the flu through our visits, through our contacts, and also that we contribute to what I described earlier as the herd immunity. And I see it personally, no differently from the way I see having vaccinations or immunizations before we start working. We're all told you've got to have your hepatitis B, we go away and do it, we check our tetanus levels, etc., and we all come into work knowing that we're fully protected and that we will also protect people if, for example, there's a misadventure such as a needle stick injury. So I think that policy, whilst it hasn't changed now, may change in future, and it will change on account of people continuing to refuse the flu vaccine. So let's go out and do it now that it's well within our hands, and let's do it to protect ourselves and protect patients and families.
And what would you say to members of staff who refuse the vaccine because they say that the flu jab makes you ill?
Well, of course, it might make you have pain at the site of the injury. It may result in a slight temperature, but all of that will only last a day or two. That, to my mind, actually shows that it's working because your body is fighting the foreign body that's just been put into you. That way, it gears up to fight the real flu virus if indeed you get infected. So having those initial side effects for 2 or 3 days is absolutely fundamental to the way this stuff works. And to my mind, a couple of tablets of paracetamol or something that your GP or chemist recommends to you will not go amiss here. It should help you. But you need to think about the real benefits. And I think that those benefits far outweigh any inconvenience or discomfort that you may feel for the first 2 or 3 days.
Thank you, Ify. And hopefully his words may have resonated with some of you watching who've been hesitant to have the flu jab up until now. I know that our flu champions are trying to make it as easy and convenient for you to get the vaccine during your busy work schedule. Please do check their flu pages on the Ox to see when and where they'll be over the next few weeks. We'd still welcome emails from you, and if you'd like you or your team to be featured in a future Oxwide, our DLD teams did just that recently to showcase their work and have had nothing but praise ever since. So please drop us a line. We look forward to hearing from you. But that's all we have time for this week. Don't forget to keep checking the Ox for all the latest news on Oxcare and of course where you can get your flu jab if you haven't done so already. So until next time, goodbye.